22 million Americans saw their costs jump 114% overnight, from an average of $880 per year to $1,904. You were promised by the politicians that your costs would go down. Instead, they've skyrocketed. Medical costs have doubled in just the last 10 years, rising 3 times faster than inflation. Picture this. You're a teacher in Ohio, working 2 jobs to make ends meet. Your daughter needs surgery. You have insurance through the Affordable Care Act. Then you get the letter. January 1st, your premium jumps 114%. Your $400 a monthly premium just became $857. That's $5,484 more per year coming straight out of your paycheck. You were promised by the politicians that your costs would go down. Instead, they've skyrocketed. And here's the shocking part. This is happening to 22 million Americans right now. That's 1 in 15 people in this country. Medical costs have doubled in just the last 10 years, rising 3 times faster than inflation. But what's really disturbing is this. Our politicians are exploiting this pain for political advantage instead of solving the problem. Today, I'm going to show you why medical costs keep rising, why the current system is designed to fail, and the simple solution that's already proven to work. By the end of this video, you'll understand exactly what needs to happen. Welcome, Patriots, to this edition of Common Sense for America. I'm Bruce Rutherford, your host and commentator, coming to you from the beautiful Westwood Golf Club in Houston, Texas. Today, we're tackling the medical cost crisis that's crushing American families and threatening the American dream itself. If you're watching on YouTube, hit that like button and subscribe. Now let's dive in. Here's what's happened. On December 31st, 2025, federal insurance premium subsidies for the Affordable Care Act expired. When that happened, 22 million Americans saw their costs jump 114% overnight, from an average of $880 per year to $1,904. These are teachers, small business owners, families just trying to get by. Now, I understand why people support these subsidies. They say these families need help. Medical care is a right. We can't just let people suffer. And I get that. Nobody wants to see families bankrupt by illnesses. But here's the problem. Subsidies don't fix what's broken. They hide the real costs, and somebody still pays. The taxpayer pays, adding to our $36 trillion, actually it's $38 trillion as I speak, national debt. The real question is, why do medical costs keep rising in the first place? Now, Thomas Sowell, the economist at Stanford's Hoover Institution, and one of my favorites, explained it perfectly. When people spend their own money on themselves, they care about both quality and price. When they spend other people's money on themselves, they care only about quality. When they spend other people's money on other people, they care about neither. Milton Friedman, the Nobel Prize-winning economist, built on this insight. He argued for what he called catastrophic insurance only. Insurance should cover true emergencies, while consumers should pay directly for routine care from health savings accounts. Friedman understood that competition and consumer choice drive costs down and improve quality. That's not opinion, that's an economic law. Now that's why medical costs keep rising. When you're spending insurance money on your health care, you don't care what it costs. When insurance companies spend on you, they're not as careful as you would be with your own money. Systems incentives are all wrong. Let me show you how this works in the real world. In 1960, American families paid 90% of their own medical costs directly out of their pockets. Today, that's completely flipped. Insurance pays 90%, and costs rose 800% faster than the general rate of inflation during that reversal. Think about that. Every other product got cheaper or stayed flat relative to wages, but medicine and medical services went through the roof. Why? because government mandated that insurance cover more and more services, removing patients from spending decisions. Each mandate created what economists call a third-party payer system. Imagine that you need an MRI. Your doctor orders it. The insurance company negotiates with the hospital, say $2,000. But you don't see that bill. You pay your $50 copay and the insurance company pays the rest. Do you shop around? No. Do you ask for alternatives? No. Do you even know what it costs? Usually no. The hospital knows this, so they can charge $2,000 because the insurance company will pay. Insurance passes that cost on to employers and through to you in higher premiums. Next year, the cycle repeats itself with even higher prices. Now, does any of this make any sense to you? But here's the remarkable thing. There are two sectors where medical costs have actually decreased. LASIK eye surgery, which I've had, and cosmetic surgery, which I'm going to have. In 1999, LASIK cost about $2,100 per eye. Today, with dramatically better technology, bladeless lasers, wavefront customization, it costs around $2,000 to $2,200. The price held flat while quality skyrocketed. Cosmetic surgery shows the same pattern. Now, what do these two have in common? Insurance does not cover them. Patients pay directly. They shop for the best combination of quality and price. Doctors compete by offering better service and lower prices. We've proven that that works. When patients control spending, costs go down. When insurance companies control it, costs go up. Now, you might be thinking, but Bruce, what about serious medical care? What about emergencies? Well, here's the thing. 85% of medical spending is on routine, predictable services. Doctor visits, prescriptions, scheduled surgeries, diagnostic tests. These are exactly the purchases people can shop for. And when hospitals compete on price for routine procedures, these efficiencies carry over to emergency care too. So what's the solution? It's not more subsidies. We've tried that, and costs keep rising. It's not single-payer health care either. When government controls all spending, you get rationing and waiting lists and inferior care. The answer is what I call the voucher model for health insurance. When you need medical care, your insurance company gives you a voucher for the anticipated cost. They also give you professional advice on what the service should cost based on their data. Then you shop for the best combination of quality and price. If you find a provider charging less than the voucher, both sides now have an incentive to find the best value. You're motivated to shop because you benefit directly. Insurance companies benefit because their costs go down. Patients wanting LASIK surgery and cosmetic surgery shopped for the best combination of quality and cost. That created competition that brought costs down. The system can work for all medical services. But there's something else we must demand. Medical device manufacturers and pharmaceutical companies must publish their prices transparently. Right now, they're negotiated in secret deals with different insurance companies and hospitals. You can buy the exact same pacemaker at one hospital for $8,000 and another charges $25,000. And you'd never know the difference. When pharmaceutical companies charge $750 for an EpiPen that costs $30 to manufacture, people have a right to know those numbers. This isn't about government price controls. It's about basic market transparency. You can't have a functioning market without price information. In 2021, CMS, Content for Management Systems, implemented a hospital price transparency rule requiring hospitals to publish prices. We need the same requirement for device manufacturers and drug companies. Price transparency plus consumer choice equals lower costs. It's worked for every other industry in human history. It will work for American healthcare too. Now, how do we make this happen? Like school vouchers, this must be done state by state. Legislatures need to pass laws changing how health insurance operates. Texas just passed universal school vouchers. Florida and Arizona did that too. If we can reform education state by state, we can reform healthcare the same way, state by state. There's one more thing we can do to control healthcare costs. Most medical expenses happen in the first year of life and in the last year or two of life. Many states don't allow medically assisted death for terminally ill patients of sound mind who wish to end their lives with dignity. New York just passed, and Governor Hochul has signed a medical assistance for the dying bill. Now the states should follow that example, and I hope Texas will. It's just common sense that a person of sound mind should be able to decide whether to continue suffering or to die with dignity. This isn't about government forcing anything. It's about giving individuals control over their own lives and deaths. So here's what you need to remember. The medical cost crisis isn't caused by greedy doctors or heartless insurance companies. This isn't about government forcing anything. It's about giving individuals control over their own lives and deaths. Here's what you need to remember. The medical cost crisis isn't caused by greedy doctors or heartless insurance companies. It's caused by a broken system that removes patients from spending decisions. When patients control the money, costs go down. When insurance companies or government controls the money, costs go up. We've proven this with LASIK and cosmetic surgery. We can prove it with all of healthcare. This matters because 22 million Americans are about to see their premiums go up 114%. But more than that, this matters because 22 million Americans are about to see their health insurance premiums jump 114%. But more than that, this matters because every family in America deserves affordable health care. Not through subsidies that hide the problem, but through real market competition that actually solves the problem. Now, please share this video with anyone struggling with medical bills or worried about insurance costs. Next week, I'm going to show you the unseen global crisis, drought and water shortages. Until then, think clearly about the incentives that drive costs up or down. I'm Bruce Rutherford. God bless you and yours, and God bless America.